Alright guys, so my name is DJ Aldridge and welcome down to my first podcast. It's called Taboo Talk, and today we'll be focusing on men's health, and we have so much to discuss. If you haven't joined us, if you've joined us, I meant to say, you should definitely go over to YouTube and subscribe at Taboo Talk and Facebook at Taboo Talk. So this is a very bold podcast, and I know you guys would love it. So let me introduce you to our doctor. I don't want to do the introduction. So, Doc, how are you?
I'm good.
It's very nice having you on our program.
So much.
Would you like to say what's your name? Where are you from?
Sure. My name is Dr. Yip. I'm originally from Nigeria, but I've been in Guyana for over 10 years. So I could say I am Guyanese.
Yeah, well, you're Guyanese now. So welcome to Guyana. You got 3,000 square mile. Yeah. And I know since you've been here, you must visit places. Have you been to the Kaitra farm?
I've flown through over here.
That doesn't come. Yeah. But anyway, men's health is something that most persons or most men, they turn a blind eye to. And you are a urologist, am I correct?
Right, so I've been working in the Department of Urology for about 8 years. I'm currently a resident in the Department of Urology.
Lovely. And what are some of the common issues that you would have encountered in this medical field?
Specifically to men's health?
Yes, men's health.
Right, so there's a whole lot, but the most common ones, if I should answer the question directly, for men especially, we have seen BPH, what locally people would refer to as stoppage of water. Mm-hmm. So that's BPH stands for benign prostatic hypertrophy. So pretty much means as we age, we as men over the age of 40, changes in hormones in our body, pretty much testosterone is converted to another form mm-hmm. that makes the prostate bigger in size. Mm-hmm. And when the prostate gets bigger in size, it puts pressure on the tube that we pass urine through. And you get men coming with problems like straining to pass urine, waking up multiple times at night to pass urine. Sometimes they can't control their urine. So in my experience, that is the most common one that men present with.
Great. And I've heard a lot of stories about, even sitting on corners or even scrolling through social media. You mentioned frequent usage of washroom, urine, going to the washroom to urine instead. Right. Would that be an early sign of prostate?
Prostate cancer.
Yeah.
Right. So you really can't differentiate between prostate cancer and BPH in terms of their symptoms and how early they present. So mm-hmm. a man that has prostate cancer can present like a man that has enlarged prostate. So a man with prostate cancer can have blood in their urine like a man that has enlarged prostate. He can have problems passing urine. They can have straining. In some cases, they might not present with any of those symptoms.
Okay, and most of those symptoms are early stages. And would it be safe to say that those early stages, men overlook? We overlook those stages?
Right. So again, I wouldn't say it's early signs because sometimes by the time men present or we pick up that they might have prostate cancer, it's already too late. Mm-hmm. But most times when men see those things, some of them don't come to us. Some of them present pretty late.
Pretty late. And being late treating this here, how serious can it be? How serious can this be if it's treated late?
Right. So in the case of prostate cancer, benign one, the enlarged prostate, mm-hmm. The most it's going to do to you would be you can pass urine as you should, you can get kidney problem. But the prostate cancer one, it can be pretty serious. So in the worst case scenario, the man might present in a situation where they can't even move. Mm-hmm. So they might be paralyzed from the legs down if the cancer spread to the bones.
That's serious? That's serious?
Yeah, it could be that serious.
Wow. And when checking for prostate, would you say, based on your profession, would you say men are scared because of the way you check for this here? Because like they say, like your finger need to go in a male butt.
Right.
So, I would ask you, is that why you think men are scared to say, hey, let me go get a checkup, let me go get myself tested or something?
Trust me, you hit the nail on the head there. So, as a man and the little experience, most men don't want to come and see the urologist because of that problem, and they don't even want to talk about it. And another thing is an ego problem. You know, we as men, you have problem passing urine, you don't want to tell even the wife. So women would have to find out. So to answer the question, yes, they feel that when they come, the doctor is going to stick the finger at the bottom. Am I just thinking?
Yeah, because that's been violated. That's been like, no, that's been violated. You know? But is that the only way? Like sticking your finger in a man's butt? Is that the only way to like check for prostate?
So that's a pretty good question. I think it's a good point to clarify this. So you can diagnose an enlarged prostate with ultrasound. But when we're talking about prostate cancer, all right, there are some findings you would, pick up when you do the digital rectal examination.
Okay.
How the prostate feels from a normal prostate to the one that is just enlarged and the one that has prostate cancer. So that's the reason why that exam is done, to see what you can pick up that ultrasound can tell you.
Great. And another question, I think this discussion here, especially prostate, it's a very long discussion. We can be here throughout this entire podcast. Something that I want to ask as well, when it comes to male health, how in your profession, how is infertility? Is it on the rise, or we're getting somewhere where we can have more families running?
So I wouldn't say it's on the rise. Again, it comes back to men hiding their problem. Most of the men that will show up for investigating fertility, it will be their spouses, their wives pushing them. We gotta get the baby,
Yeah.
So I wouldn't say it's on the rise. It's just that maybe more men are coming forward. So like, I'm trying to get a baby, and then it looks like we're diagnosing more.
So it's good to say that men are in tune with infertility. They're coming to get help. They're coming to get help, and in most cases they have their spouse who is supporting them and pushing them.
Yeah, most times women will be the one pushing them.
And since we're on the topic of infertility, does it always need a pill, or can the issue be dealt with surgically?
You mean infertility?
Yes.
Or you mean like erectile dysfunction?
No, infertility.
Infertility.
Yes.
Right. So infertility pretty much depends on what the cause is. All right. So if it's a mechanical problem, so for example, if a man has any blockages, or a woman on the other hand, because let me just take a pin here. Most times when you have couples not being able to start a family, it's not always the man. It could be the woman.
Yeah.
All right. So in the woman, it could be a problem, maybe the tube is blocked, or for whatever reason. All right. So depending on what the cause is, it's going to be treated based on the cause.
Is it anything? Does it have anything to do with male and female not matching? Have you ever heard something like that before?
Yeah, I've heard something like that, but there really is nothing like.
Is that scientifically proven? That's not scientifically proven.
It's nothing.
So that's not scientifically proven, okay? Because I've known a lot of persons, they've been together in relationship for like 20 years, more years, right? And never had a child. And from the time those two persons separate, a new dude come in place, and
exactly.
she get pregnant, or it could be vice versa, right?
Exactly.
Now, the man left the house, he get a new girlfriend, and most persons would say, it's because their blood type doesn't match, or does it make sense? Or?
No, that doesn't make sense scientifically. So pretty much what happens is this: like I said, both couples, we start treating those people by investigating both couples. So in urology, we're going to investigate the man holistically, and then the woman, we're going to send the woman to the gynecology doctor to check her out and see if there's any issues. Yeah. So again, if they separate, one person makes a child, it's gotta be that maybe the problem was with the other person.
Yeah, because I know a lot of persons handle this differently, and just like you said, there is probably a blockage somewhere. Speaking about blockage, and since we're on the topic of infertility, I know infertility, can it lead to ED?
Infertility, no, the ED most likely would lead to infertility.
Oh, okay, great.
Because by the definition of ED, erectile dysfunction, so if a man persistently or recurrently has the inability to start or maintain erection enough to satisfy a woman, right? If you don't have that, that's how we define ED. And if you don't have an erection, there's no way you're going to impregnate a woman,
Doc, but erectile dysfunction, it's something most men are scared to have a topic about. I mean, I would be scared if it stopped working, right? But I mean, think about it this way. I have a problem and I can't speak to my wife about it, or I can't speak to a friend about it, so I would go take a pill. But is that the safe way? Because here why? Because if I go to get treatment for this, the doctor's gonna give me a pill. No?
Not always.
Not always. So how is that being treated?
Right. So erectile dysfunction, I just defined it. So we can classify it based on types. So you can have a psychogenic type of erectile dysfunction. So it pretty much means that it's a psychological problem. So it could be the person has a performance anxiety. How am I going to do? Am I going to satisfy her? Maybe issues, strain in the relationship, stress, work-related stress, come home tired or just don't have that feeling. So many things that has to do with psychologically. Now, you can also have a physical type, maybe you gotta be something with the body, maybe, nerves are not working as it should, blood supply to the area is not working as it should, or anything of that nature. So if a patient has a problem that is psychogenic and you give them pill, it's not going to work. Exactly, and vice versa.
So since you mentioned something about anxiety there, so there are some dudes, about to get sex, and because of excitement, and that's it for the rest of the shift. Right, that's it for the rest of the shift. That is something normal, right?
I wouldn't say it's normal.
So me meeting a girl about to get sex, and I just and like 2 minutes. That's not normal.
That's not normal. So that is some part of the definition of a premature ejaculation. All right. So premature ejaculation is if a man from the time of penetrative sex and the man ejaculates before, it's like 5 minutes. That's the definition. The standard should be at least 5 minutes. Right, but again, I guess this can have other issues contributing to it.
Yeah, because here I'm gonna say it could be normal because I'm sure I have had experience and my friends have had experience. Whereas we just jump on and come quick.
Excited,
right? It's excitement,
right?
So ladies, it's just excitement. It's just excitement. It's nothing, right? It's nothing serious,
right? So it can also be said to be a normal variant. So if that doesn't happen all the time, all right, so you can't say that the person has a premature ejaculation. So it could just be the excitement at the first time, like you said, and that happens.
Great. So there's a conversation that I want to spend a few more minutes in because I have a few more questions. But before we do so, we're going to take a break. Before we do so, remember this podcast has been sponsored by Straight Vibes. And Straight Vibes has been distributed by Bryden's Guyana. So, and Straight Vibes is in 4 flavors. You have the Ramping Shop, the Unstoppable, the Fever, and Electric. And you should grab yourself one only at
This around and no boring.
It make ugly girl look like pretty darling.
Straight vibes still a morning.
Come for your uncle, somebody should have want it.
When you want to feel real vibes. When you want to feel straight vibes.
Somebody else get ice. Make TG.
Alright guys, we have returned. And once again, this is our first episode. It's Taboo Talk. My name is DJ Aldridge if you just joined us. And I have Dr. Josh. He's a urologist. And, we're just discussing about men's health. We're talking so much. And don't even skip it because we're about to get into something very serious. And, I think all men. And ladies, if you're watching, just pull that guy next to you and say, hey, babes, let's watch something. So, Doc, we were talking earlier about infertility. And one of the questions that someone had is, most guys that has infertility, that is experienced infertility, they're shamed, right? What would you say to them being in that field? I know you probably dealt with a few situations before. What would you say to encourage them?
So the key thing is, forgetting about what people are going to say, and if you're really interested in, procreation, starting a family, you should come out because you could get help depending on what is the cause of the problem. Again, the key thing is what people think that people are going to say about their situation.
Yeah.
So men feel ashamed, they feel embarrassed, they look at their colleagues, their age mate, what they've been achieved. So number one thing that needs to be done is education.
Mm-hmm.
Men have to understand that they could get help. They need to come out of their closet and forget about what people think about their situation and open up and talk to us. That is the key problem we have. Men don't come up. Men hide their problems. That is true. They hide their problems. If you go to the hospital, the most patients you're going to see are women. Men hide their problem. When they show up, it's too late. So I think men should come out. That is my point of encouragement. Come out. If you think you're ready to start a family, you're trying, come out. Sometimes it might be they're trying it the wrong way.
Yeah, that's true.
Because that's why when we're investigating men with infertility, we ask them some questions. Do you have a vaginal sex?
Mm-hmm.
Do you try to have sex during your wife's ovulation? Is your wife actively trying? Is your wife, are you sure she's not using any kind of contraception?
Mm-hmm.
So all those are the kind of things we check and then we investigate. So again, we're encouraging men to come out and open up and talk to people.
Sounds good. And I know we also talk about ED. I have a question that a friend asked me long ago. With erectile dysfunction, just like how dudes are shamed to talk about what is happening to them, in this case, most of them will take a pill. There's a lot of enhancement pill. There's a lot of enhancement drinks and these things. Are those things healthy? Or does it actually assist? Or is there a long-term impact?
Right. So first, some of those medications, some of them are just common supplements, and you really can't say, if you buy a supplement that says it's going to help with erectile dysfunction, you can't say what is on the inside. Right. So medications that have not been approved by, for example, FDA, we really don't recommend men to use these medications. It is recommended that you go and see a doctor, a family physician that is going to, refer you to a urologist. The urologist can see you, probe you, investigate and see exactly what, is the cause of your problem and how it can be fixed. All right. So men grabbing supplements to help them. Sometimes some people get help. All right, but I can't say, for a fact that a lot of people get help because, like I would have said earlier, if the cause of your erectile dysfunction is not something that medication can fix, you can take the medication for 10 years and you're not going to get any help.
And something that just came to it can be erectile dysfunction. It can be stress levels as well.
Right.
Stress levels, food, a lot of what you're consuming and stuff. Could be.
Not really. So again, like I would have mentioned, erectile dysfunction can have two major classes. So you can have the physical part, you can have the psychogenic, which is even more common. So anxiety, stress, problems with relationship, and all those things can impact. And I mean, the key management for that is pretty much a multidisciplinary approach where you see a urologist and talk to urologist, and during the investigation, if the urologist, picks up that this man has more of a psychological issue, right, would recommend that patient to see maybe a sexual psychotherapist, right, a psychologist that's going to try to help them with their whatever the underground issue is, anxiety, depression, whatever it is. And when they fix that now, then they would, evaluate them and see if there is improvement in their erectile, dysfunction. If there's an improvement, so we can now really confirm that this was the cause. If maybe they see have improvement and they find out there's another a medical component or a physical component where a urologist is going to fix. So it could be that's where the multidisciplinary approach comes in. So the psychologist helps on one part and the urologist helps. So if that is a mixed one, so you can have a mix. So physical, issues, you can have psychogenic, you can have only psychogenic, you can have only physical. So it depends on what the cause is.
So based on the cause, there is someone to help you psychological and
Exactly.
Okay, great.
So that's why I was saying, if the patient has, a physical problem that has to be fixed, has a problem with the neurons or the nerves, the hormones, all right, and that has to be fixed.
Yeah.
All right. If you send that person to a psychologist, the psychologist is not going to fix that.
Yeah, but just know what is happening.
Exactly. So our job is to investigate, find out from those patients, run some lab tests, and say, okay, this is what's causing this, and treat those patients accordingly.
Sounds good. That's a lot. That there is so much. That there is like so much. And we were on the topic earlier of prostate.
Right.
A question that slipped me. From what age can somebody check to see or be diagnosed with prostate?
Right, it's a very good question. So, especially for men of African ancestry, the recommendation, looking at the recent Guyana guidelines, age of 40. All right, so from that age of 40, you don't have to have any signs of problems with passing urine or anything of that sort. As far as you're up to the age of 40, it's recommended that you begin to investigate. A part of that investigation, most importantly, is a blood test that is called a PSA. It stands for prostate specific antigen. All right, so the reference range we're looking for is between 0 and 4. Anything over 4, it doesn't mean that you have prostate cancer. All right, it's just telling you that we should do some more investigations, because there's so many things that can cause the PSA to go up. All right, even a simple thing like you having a urinary tract infection within the prostate, even sexual intercourse, masturbation, cycling, because you're sitting right over the prostate area. All those things can elevate the PSA a little bit. So when we see a man that has a high PSA, we don't just say, oh, he has prostate cancer. All right, so we have to investigate some more.
So masturbation is a factor to this too?
Yeah, so why I mentioned that is anything that, can cause some kind of irritation or disturbance to the prostate, can push out the prostate-specific antigen.
I hope my friend listening.
I'm not saying it's a bad thing. So it is something that we use, as part of the investigation.
Okay.
Yes.
And is there a way technology can work to
diagnose?
Correct, to diagnose this?
Right. So when we have a strong suspicion for prostate cancer, what we do is prostate biopsy. Right. So we're going to it's a simple 10 minutes procedure where we take some samples from the prostate and send it to the histopathology lab, and they're going to look at those samples under the microscope and tell us if they've seen cancer cells or not. So that's how we diagnose it. Currently, we're doing transrectal biopsy, meaning that we're going through the rectum. I use ultrasound guidance to directly get to the prostate and take those samples off. Now, in higher centers like in the United States, they're doing transperineum. So instead of going through the rectum, they go straight through the perineum, which is the area between the anal opening and the scrotum. Right? They could go through that area and take some samples from the prostate. The advantage is that, there's less chance of patient getting infection in comparison to going through the rectum.
I've never, I can't say I never, but probably there were a few persons that actually had prostate and share their experience. During that process, is it a painful process, or is it a painful process to be examined? Because remember, you say you gotta do some type of thing. So is it a painful process? And why I'm asking if it's a painful process is because like back to men, and we're ashamed to have a conversation. So you just picture somebody going to examine you and just like, I'm looking for something. I'm looking for, let me see, So that'll be very uncomfortable.
Yeah. Yeah, for sure. So what we do is this. Usually the examination is not painful. You're just going to feel some discomfort. Psychologically, some men will, like you said, feel violated. But we always explain to our patient that it's going to be a few seconds examination. All right. It's not, we don't enjoy it. All right. It's just because it has to be done.
It's your job, though.
So we would tell men, if a man says, if you come to me and say, Doc, this is what I'm experiencing, and I say, I think you might have issues with your prostate, I need to examine. If you say you're not comfortable, then we're not going to do it. All right. I will also explain to you that, that examination would give us some more information regarding what, we're suspecting. So it's not a painful examination. For sure, you're going to feel some discomfort. We use lubrication to ease the discomfort, and it doesn't last long.
And with all this said, if someone is diagnosed and for some reason, it could be vice versa, diagnosed or know what is happening but doesn't want to get a checkup, what is the possibility, like how long before everything just start coming in one and creating a whole putum, a whole bump?
Right. So in the case of prostate cancer, it depends on the grade it is. So we grade prostate cancers when we make diagnosis.
Okay.
So you can have it's what we call Gleason score. So a Gleason score of 3 + 3 = 6 means that there's a high chance that cancer is within the prostate. It doesn't spread. So usually it's not a very aggressive cancer, right? It's a slow-growing cancer. In fact, most men would tend to die with prostate cancer than dying from prostate cancer. All right. So again, depending, by the time some men show up to the clinic or we diagnose and they have, metastasis to bones, they can't move, it's like they would have had that prostate cancer for a very long time.
Yeah, because that would have led me to my other question, because persons say once you have cancer, it's it spreads really quick, but then it had to be situations that lead up to for it to get worse.
No, so again, it depends on that type of cancer. So some cancers are very aggressive, right? Meaning that the moment you diagnose them, before if you don't do something, it's going to spread pretty fast.
But given that prostate is a slow cancer, there is still how much time to be checked up? How much time would you say?
So again, some men can. So for example, if you find a man that has a prostate cancer that has a Gleason score of 6, all right, meaning that is still within the prostate. In those cases, we don't even treat them. There's something called active surveillance, meaning that you're not just sending them away. You bring them back maybe in 6 months, and repeat their blood test, repeat another biopsy, depending on how changed the cancer has been. So it looks like it's getting to a worse grade, and then you can start treatment for the patient. The reason for that is that some of the treatments, or most of the treatment, have serious side effects. So if you're going to use radiation, it has some complications. If you're going to use the medications, it does have some complications. So you don't want to introduce those chemicals into a man that in the next 10 years his problem or his cancer wouldn't bother him. You understand? So it's based on the grade of the cancer.
Yeah, and a man has been diagnosed with prostate. He went through the normal procedure, have it looked after. Does he use a lot of medication after? After and before and after, does he use medication until he dies, or to actually what's the word I'm looking for?
To keep the cancer down?
To keep it down.
Right. Good question. So it depends again on when the man presents where the cancer is.
Okay.
So when the man presents, if the cancer is still within the prostate, there are so many options of managing. So think of it, so let's say this prostate is bigger than this. So let's say the cancer is within this area of my finger, and you remove that area. We cut surgery and remove the whole prostate. So that means the whole cancer is gone.
Okay, so no pills,
The
no
man
pills.
doesn't need to be on any medication for that, right? Now, if the man, when he presents, the cancer would have spread outside of the prostate, right? You removing the prostate is not going to stop the cancer. So those kind of those kind of men can benefit from some other, interventions like medications, injections, that is going to try to reduce, the spread of that cancer. Those men now might have to be on medication injections for a little longer time, like 2-3 years, depending on how their PSA is. So we monitor their progression, how they're responding to the medication by that PSA I mentioned earlier, the prostate-specific antigen. If it drops down to a very low level, so we have the thought that the cancer is being controlled, the spread is being controlled.
Great. That there, everything in a nutshell was like a lot to take in. It got me thinking right now. Because, to be honest, for me, I know a lot of men can relate. We be like, I ain't going and check no prostate, I ain't dead. You know what I mean? But then having this conversation in depth, it gives you a different thinking. It gives you an approach to start somewhere.
Yes.
So I want to say thank you very much for coming through, sharing this knowledge here.
Anytime.
And I hope this wouldn't be our last time seeing you.
Absolutely.
Thank you very much for coming through.
Thanks so much. My pleasure.
All right, guys. So we're about to wrap things up. Do remember to subscribe on YouTube and check us out on Facebook. My name is DJ Alridge. Welcome to Taboo Talk. Join us for the next episode.
Taboo Talk Podcast will also be streaming live on Soundchat Radio and TV with Irish and Chin.